Okay, our last obstetrical procedure that we'll talk about is cervical cerclage. The cervical cerclage is a transvaginal procedure performed between 14 to 20 weeks gestation under regional or general anesthesia in the operating room. With pregnant women, we like to use regional anesthesia. General anesthesia would be used less likely. The indication for a cervical cerclage is cervical insufficiency, and we'll talk about that in more detail in another section. The cerclage is essentially a suture placed in the cervix, encircling the cervical canal to keep it from dilating. This is a risky procedure because if there is a foreign body left in place, it can cause bleeding, it can cause infection. If it is done after the cervix is already dilated, membrane rupture and fetal loss is significant. Cervical insufficiency is diagnosed when you have painless dilation of the cervix prior to viability, resulting in delivery of a non-viable normal fetus. In the absence of bleeding, in the absence of ruptured membranes, in the absence of contractions. Cervical insufficiency. If the cervix is already dilated and the membranes are bulging, we would call this an emergency procedure. And those are always more risky than which are done electively. If we have a diagnosis historically and we place it before the cervix is shortened and dilated, much better outcome. This image shows the most common cervical cerclage which is done, which is a McDonald cerclage. And you can see the suture goes in, comes out, goes in, comes out, like what is called a purse string suture. You then tighten it down, it holds the cervical canal closed externally, and the suture is left in place and removed around 36 weeks. The reason we wait till after 14 weeks to place it is to ensure that with ultrasound, we know that the fetus is anatomically normal. Here we have another example of the McDonald cerclage, which is placed. The nice thing about the McDonald is you can remove the suture and the patient can have a vaginal delivery. And that is the end of cervical cerclage.